Katie with Ria Health, and welcome to our Ask a Doctor series. I'm here today with Dr. Mendelson. He is a part of our medical team here at Ria, and Dr. Mendelson has over 30 years of experience in treating people with alcohol use disorder. Dr. Mendelson, the question we have for you today is on the topic of medication-assisted treatment for alcohol use disorder. What is it exactly, and why does it have greater success than, say, 12 steps or abstinence alone?
Well, so the medication-assisted treatment could also just be called medication treatment for alcoholism. It turns out, alcohol is a drug, and many drugs have effects in specific parts of the brain, and they alter the biology and the chemistry of you, and you can modify those effects with other drugs. So it's not a big surprise that you should be able to modify the effects of alcohol with a medication, and we do that with other things that are essentially medications as well. So medication-assisted treatment is where people choose to use medications in addition to other things in order to cut down or control their drinking. And abstinence-based programs have been shown to have a very high failure rate. The real issue is not that they don't work. If you put someone in a residential program for a month and there's absolutely no access to alcohol, they don't drink during that month. And so they had no drinking they were sober during that time period. But you put them back into our communities, which are just seas of alcohol around the world. Everyone is literally no more than a 5-minute walk from alcohol or a 5-minute trip from alcohol any place on the planet virtually. Like if people start to drink again in those circumstances and they haven't altered any of their actual body's reactions to alcohol, then they're going to just get back to the same dose of alcohol they were at before and the same complications. So medication-assisted treatment really should be thought of as medication-modifying treatment of the alcohol effect and or of its neurobiological consequences. And I think that's the more cogent view of now, if you only believe that change can only happen through a spiritual transformation, medications may not get you there. But on the other hand, you always have to ask, how did the medications get around? If they're part of the spiritual universe, right? Maybe they do contain something that alters your spirituality as well. Okay. Whoa. Okay.
Thank you so much.
Okay.
Thank you so much for watching. If you have any of your own questions on the topic of alcohol use disorder and medication-assisted treatment, please post them in the comments below. And don't forget to subscribe for more content on this topic. And thank you so much for watching.